Hi everyone, welcome to my channel Capsa. Today we will learn about Tourette syndrome. So Tourette syndrome is named after Gilles de la Tourette, a French neurobiologist who first described the condition in 1885. It is a complex neurological disorder that causes a person to sudden uncontrolled repeated muscle jerks or muscle movements or vocal sounds, or also known as phonic sounds, which are referred to as tics. That's why it is also called as Gilles de la Tourette syndrome, Tourette disorder, Tourette disease, chronic motor and vocal tic disorders like this. Tourette syndrome affects more boys than girls, and majority of cases occurring in children aged 4 to 12 years. So if you have tics, you cannot stop your body from having them. Or we can say people with tics feel an irresistible urge to perform their tics. It is more common that severity of the condition worsen around the period of puberty. Now, what are the causes? So, exact cause is not known or unknown, but research suggests these followings. First one is involvement of neurotransmitters. Scientists believe that chemical messengers in the brain like dopamine, norepinephrine or serotonin may not communicate properly between nerve cells in case of person with TS, because these neurotransmitters are responsible for carrying nerve signals and producing and controlling voluntary movements. Second one is abnormalities in the certain region of brains. According to the second theory, if there is any abnormalities in the certain regions of brain, including basal ganglia, frontal lobe, cortex, as well as the circuits like cortico-striatothalamo-cortical or CSTC that connect these regions, you may have suffering from TS. Third one is genetics. Most of the cases TS are caused by gene, and it is an autosomal dominant disorder. Here autosomal means both boys and girls can affect it. Dominant means that only one copy of the gene is needed to have that condition. So mutation in SLTRK1 gene have been identified, which participated in the growth of axons and dendrites. However, not everyone with the gene will have the symptoms of TS, and even if the parent passes the gene to the child, they may not have any symptoms. Fourth cause is environmental triggers or factors like encephalitis, low birth weight, head injury, this kind of. Now, what are the symptoms? So, the first symptoms or tics usually occur between the ages of 5 and 10 years, or generally in the head and neck area, but these may progress to the muscles of torso, arms, legs, etc. And based on the characteristics, tics are classified into two categories: motor tics when muscles are involved, and vocal tics where or phonic tics when presence of sound. So simple motor tics, complex motor tics, simple vocal tics, complex vocal tics. Simple tics are sudden, quick, repetitive movement of the few muscles. Complex tics are several muscles are involved that perform a movement in a coordinated pattern. Simple motor tics are eye blinking, nose twitching, head or shoulder jerking, jaw or mouth movement, blepharospasm. What is blepharospasm? Also called as benign essential blepharospasm or BEB. Abnormal contraction of the eyelid muscles, that is orbicularis oculi. Okay. Now bruxism. Bruxism, it is cleaning, grinding, gnashing your teeth either while you are awake or asleep. Oculogyric movements or oculogyric crisis is the involuntary upward deviation of both eyes due to spasm and increased extraocular muscle tone. Last one is torticollis. Torticollis is a condition of the neck muscle that causes your head to tilt down. Clear? Now, complex motor tics. These are head shaking, trunk flexion, jumping, kicking, coprolalia. Copros means faces and praxis means action. Both are Greek word. Together, they refers to uncontrolled performance of obscene gesture or socially unacceptable gestures or unwanted touch. Okay. Echopraxia refers to as imitation of another person's gesture or copying. It can be physical movement or facial expression. Now, simple vocal tics are shouting, throat clearing, sniffing, coughing, grunting, squeaking, this kind of. Complex vocal tics are coprolalia, uncontrollably use inappropriate language. Echolalia is repetition of words or phrases spoken by someone else. Palilalia refers to as speech disorder that involves substituting one speech or sound for another. Someone with palilalia might say wabbit instead of rabbit, yellow instead of yellow, this kind of. Now, what are the disorders associated with TS? First one is attention deficit hyperactivity disorder or ADHD, obsessive compulsive disorders or OCD, learning disabilities, behavioral issues, anxiety, depression, autism. This kind of disorders may be associated for the patient suffering from TS. Now, what are the diagnoses? So, diagnosis is actually based on the characteristics of tics. First characteristics is if it is simple or complex. Second one is fractal quality or onset of the tics before the age of 18. If the tics happens multiple times a day or every day or on and off or more than 1 year. So tics occurs in bouts. In bouts. Bouts means tic will come and go and can change over time like second, minute, weeks, months, year. And one tic can stop as another started. Third characteristics is based on the anatomical evaluation of tics like rostral or caudal, midline or peripheral, this kind of. Second diagnosis is based on the blood test. Third is imaging test like CT scan, MRI, etc. Now, what are the treatments? So, obviously, first is based on the medications like clonidine, haloperidol, flufenazine, topiramate, this kind of medications. Second one is based on the various therapies. Which kind of therapies? These are psychotherapies. Like CBT or comprehensive behavioral intervention for tics. Now, third one is based on the surgical procedure, that is DBS or deep brain stimulation. It's a surgical procedure where a medical device is placed in your chest that sends an electrical impulse through the wires to specific area of your brain that are responsible for tics. These are the treatment procedure. So this is the end of my lecture. If you like the video, please do like, comment, share and subscribe. Thank you for your attention.